So while it may seem very obvious clinically to take into account both the mesiodistal or horizontal dimension as well as the vertical dimension that we've discussed, oftentimes in daily practice, unfortunately, these factors are not adequately taken into account. As we can see in this clinical scenario, a patient that had congenitally missing lateral incisors in the maxillary arch had undergone implant therapy at a practice prior to coming to our practice at the university. In this case scenario, you can see that the patient had the implants placed and healed and had provisional restorations in traditional approaches with fixed partial dentures. She was ready to restore the definitive implants after being cleared. And unfortunately, when we uncovered the implants and connected impression copings, you can see that there was an obvious lack of attention and forethought going forward into planning where these implants should be placed, as well as whether there was adequate clinical space to even accommodate single tooth implant crowns. This is a fairly dramatic example. And in this case scenario, the patient actually could not receive definitive restorations based on where these implants were placed. This unfortunately resulted in a lot of wasted time, cost, and stress for this particular patient that could have been avoided had adequate treatment planning been conducted from the start. So try to take this example to heart and use this as a motivation in your own practice to go ahead and actually evaluate both the horizontal and vertical spaces that you have present before an implant is planned for that particular patient.